Order. All right, good evening, everybody, and Happy New Year. Welcome to the Queen Anne's County Commissioners meeting. This is a public meeting that is being aired live on our local cable television station, QAC TV 7. These media broadcasts provide county citizens an opportunity to watch and review our scheduled public meetings. In addition to our live audience this evening, we are providing remote options for citizens to watch and participate in county commissioner meetings. Citizens may watch our meeting live on our website at qac.org/live or on our public access governmental television channel provided by Breezeline Cable Services. Citizens may also participate by joining the live Zoom meeting by going to qac.org/public comment, and citizens may also email comments to publiccomment@qac.org. All comments received will be summarized during the press and public comment period on tonight's agenda. We acknowledge everyone's participation, and by attending, you acknowledge that this session is both recorded and aired. Press and public comment will be taken and is limited to 3 minutes per person. If you do care to speak, please sign up at the information table out in the lobby. Comments longer than 3 minutes can be submitted in writing for the Commissioner's review. We will now stand and be led in the Pledge of Allegiance by Commission President Jim Moran.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, that brings us to the approval of the agenda for this evening. So our agenda for tonight's meeting, January 13th, along with the regular session minutes and the closed session minutes from the December 9th meeting have been circulated for the Commissioner's review. Any additions and or corrections?
I make a motion to accept the agenda and the previous meeting minutes as presented.
Second.
We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
All right, thank you, Commissioners. Okay, we just held a closed session under the General Provisions Article, Section 3305B1 for boards and commissions, and Section 3305B7 to consult with counsel. No decisions with the consult with counsel portion of the closed session, but we do have some board appointments to make.
The first one's a Commission on Aging. I move to appoint Jerry Jordan to the Commission on Aging. This term will expire December 31st, 2028.
Second.
We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
I move to appoint Ryan Snow to the Ethics Commission as an alternate member with a term expiring on 12/31 of 2029.
Second. We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
I move to appoint Casey Joe McKinney to the Regional Behavioral Health Advisory Committee. This term will expire on December 8th of 2028.
Second. We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
I move to appoint Jared McLean, Ryan Snow, and Abel Ortiz to fill the vacancies on the Social Services Advisory Board. This term will expire on June 30th, 2028.
Second. We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved. You want to do the,
Oh, yeah.
I move to adopt the the updated chart for the boards and commissions on which the county commissioners serve.
Second.
we have a motion and a second. Any discussion on this topic?
It's just for informational reasons. We have several boards and commissions. You just heard us make appointments to those. The commissioners that serve here in the county sit on those various boards as representatives and then report back to the fellow commissioners. So we made some adjustments on what commissioners will be representing those individual boards, and that's simply what we voted on, or will be voting on.
There you go. All those in favor signify by saying aye.
Aye.
Opposed? So moved.
All right, thank you, Commissioners. That brings us to press and public comments. So we appreciate all citizens for taking time to express views to your county commissioners. Comments are limited to 3 minutes per person. Comments longer than 3 minutes can be submitted in writing. This commission respects your desire and right to convey your message freely. When you come forward, please speak clearly at the standing microphone, state your name, your address, and your topic of interest. And in keeping with the dignity of the office, we ask that all views be expressed in a respectful and civil manner.
Mr. Falstad.
Good evening, Commissioners. Jay Falstead, Queen Anne's Conservation Association. I just want to extend some congratulations to the Commissioners, the Economic Development Commission, and especially Heather Tonelli for last week's Economic Development Summit. I was in attendance. I thought it was first rate all the way across. The panels were all good. Very informative. So I wanted to acknowledge that. But I also wanted to add something to it, which I hope you all will consider for future meetings. Unfortunately, agriculture was not mentioned at that meeting at all. And so following that, I got on the USDA website, and I hope everybody will listen to this because it's pretty impressive. I brought copies for each of you, but in Queen Anne's County, the total market value of agriculture the last year that was taken was $283 million. Over $250 million is being produced here in Queen Anne's County. Queen Anne's County is #1 in grain production, but of the 23 counties, we're in the top 10 in poultry production, nursery production, vegetables, and a couple other key things. What was also interesting on this is of the 968 producers that are in the county, 259 of those describe themselves as new and beginning farmers. And that is an encouraging number. It was much higher than what I was expecting. And so you'll hear that a lot of farmers are aging out and they're getting older. This shows that there is some rays of hope. Also, just as a final note, having served on 3 comprehensive plans over the last 25 years, one thing that you will hear over and over again, and it was also mentioned at this, is the quality of life that we have in Queen Anne's County. People love the fact that we have wide open spaces, farms and fields, forests, clean waterways in which to fish and crab. The people that are advocating for those things, myself included, are QACA, Eastern Shore Land Conservancy, Corsica River Conservancy, Shore Rivers. While we may not be considered as a component in the economic development scheme, we are all working to add to those qualities of life that everybody professes to want. And so also, I hope in a future EDC meeting, you all will consider a panel that includes those groups as well, because we are contributing. It might be a little bit differently than the bricks and mortar stuff, but it still adds to the economy. Sorry to go over a little bit of time.
Thank you.
I would also say that we didn't talk about the 90,000 acres that the commissioners have put into.
Yes, that's on here also.
Yeah.
Thank you for adding that,
Yeah.
because there's a lot of good things that.
We ran out of time.
Yeah, that we can be talking about. Anyway, there's enough copies there for each of you. Thank you.
Thanks, Jay.
That's all who signed up. Would anyone else like to speak at this present time? Seeing none, we'll close press and public comment.
Commissioners, thank you. So if you want to turn to tab number 7, we have a public hearing. So under your tab 7 legislative section, tab 7, we have a public hearing, County Ordinance 2514. This is for the Muddy Creek Waterways Improvement District. And we have County Attorney Patrick Thompson, who will officiate the hearing tonight. So Patrick?
This is a public hearing being held by the County Commission of Queen Anne's County, Tuesday, January 13th, 2026, at 5:40 p.m. in the County Commission meeting room, Liberty Building, 107 North Liberty Street, Central Maryland. The hearing to receive public comment on County Ordinance 2514, a bill entitled an act to create the Muddy Creek Waterways Improvement District, to authorize a maximum expenditure on the project of $600,000 and to levy a special benefit tax against properties in the district to repay said sums borrowed and expended thereon, and to provide for the collection thereof. Copies of the proposed ordinance have been available at the County Commissioner's office during regular business hours and online at the county website. Speakers will be limited to 3 minutes each. Testimony of any length can be submitted to the County Commissioner's office before the hearing. All hearing sites are accessible to individuals with disabilities. Sign language interpreters and assistive listening systems are available. Part of the record of this proceeding will be a certificate of publication indicating that notice of the hearing was published 2 consecutive weeks in the Bay Times, Record Observer, and newspapers of general circulation in Queen Anne's County. No one signed up. Does anybody has any public comment? Yes, ma'am.
Oh, well, we're here to
Well-
represent
Hey.
people.
Hang on.
You want to come up here, give us your name and address, please.
I didn't really intend to speak, but we are here in favor of having Muddy Creek, having this go through and getting this loan. So we're representing LPCA on Long Point Road.
Okay. Any other public comment? Yes, sir.
Sorry, I didn't sign up either. Ron Potter, I'm in the Bayview neighborhood adjoining, and I'm here to represent and say we also are wholly in favor of this project.
Any other public comment? I think that James would like you to vote on this
Yeah.
because he has a.
So we'll close the public comment portion of it, and since there's nobody here that opposed it, and I think time is a little bit critical on this, I'm gonna make a motion that we approve County Ordinance number 25-14, excuse me.
Second.
We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? So moved. There we go. Thank you, Pat.
All right, thank you, Mr. Thompson. Thank you, Commissioners. For the folks in the audience, do you want to go ahead and do action item number 8 while they're here? This is the contract for that particular Muddy Creek
Yeah.
dredging project. Okay, Commissioners, if you want to turn to tab number 3, item number 8, this is the last item on the agenda. This is the Long Point Boat Basin and Muddy Creek dredging project. So our Parks and Recreation Department Public Land Use Division held a bid opening on December 8th for this particular dredging project. 3 sealed bids were received, ranging from $452,000 to $897,000. And it is recommended to award the bid to the low bid contractor, Switzer Marine LLC from Preston, Maryland, for $452,000. This has been endorsed by the Maryland Department of Natural Resources for approval.
I move to authorize the Department of Parks and Recreation to contract with Switzer Marine LLC from Preston, Maryland for the Long Point Boat Basin and Muddy Creek dredging project in the amount of $452,000. This award is contingent upon adoption of Ordinance 25-14, which has now been adopted, to establish the Muddy Creek Waterway Improvement District, and approval of $250,000 in additional MDDNR with tax district dredging grant loan funds.
That has been approved as well today, as well, the 250, so we're good there.
Second.
We have a motion and a second. Any discussion?
I just want to comment that the folks at Long Point Road and Bayview Communities have been working tirelessly through the governmental red tape that it took to get to where we are today. And they've been patient throughout the process. They've worked hard in making the contacts and connections that they've had to make to get us to where we are, which I think is a classic example of a community coming together and refusing to give up and not let the bureaucratic red tape get in the way of something that should have taken place a long time ago. So to the folks at Bayview and Long Point Road, congratulations.
Do you guys want to say anything? Mr. Wood?
I'd like to say congratulations to Rob Morris, who really, and whoever he worked with at Bayview, because those two gentlemen, they persevered for years.
Mhm.
Yes, yeah, they've been our meeting with.
Very good.
All right.
All right, all those in favor signify by saying aye.
Aye.
Opposed? So moved. Onward or upward?
All right, on we go. Thank you, Commissioners. Okay, now jumping back to presentations, tab number 6, Commissioners. Tab 6, item 1, page 1, there's nothing in there, just a placeholder for Miss Melinda Ray, Character Counts Coordinator, for an update, and I do not see
Nope.
Melinda today. Okay. All right, so item number 2, tab 6, we have Mr. Ken Kozel, President, and Ms. Laura Wilson, Director of External Affairs, Community Liaison with the University of Maryland Shore Regional Health. They have an update. There is a presentation up on the screen, and the presentation is also in your book. Item 2, tab 6, pages 2 through 21. Mr. Kozel?
Sir, how are you?
Wilson, thank you.
Yeah, that's for
See
you,
ya.
just
Oh,
in
yeah.
case.
I thought you'd go gentle on me since I brought Laura with me today. Good evening, everybody. How are you this evening?
Good.
Good, good.
Great, great.
All
Thank you so much for the opportunity to be here with you this evening and give you an update on what's going on in healthcare. I think something
All right.
that's near and dear to my heart, but also near and dear to our community as we evolve as a healthcare system. We've got a PowerPoint presentation for you. We understand we've got maybe 10 to 15 minutes, so we'll keep it brief and allow time for your questions. But at the end of the conversation, I think what we're trying to convey with you today is healthcare is consistently and constantly changing. That's one of the constants in our industry, is that change always seems to be occurring. We at Shore Regional Health try to be ahead of that change, and I'll demonstrate how we've done that over the last 15 years, up to and including building the regional medical center. And then we'll talk about how the shift in the industry really focuses on hospital-based care, but as well as health and wellness of the community that we serve. So that's critically important to our success as well. So Laura and I will tag team that presentation, and we'll go through that with you today. Next slide, please. One more. So I always like to start to give a context, and this context is at 10,000 feet, and this tries to share with you what's going on in rural healthcare across the country. And the slide is just broken down by sharing with you that over the past couple of decades, rural health and hospitals in rural communities have closed. Almost 200 over the course of the country in the last couple of decades. But that's only part of the story. The other part of the story is that if they haven't closed, many rural hospitals across the country are reducing services. And some of these are critical services like deliveries, like cancer care. So I think it's important to keep an eye on those hospitals as well. But the real truth of the matter is currently over 700 rural hospitals are in financial straits, and they're at significant risk for closure. So this is what's going on in the nation with regard to rural healthcare, and it's just really, really tough to make the economics of rural healthcare work. The costs are very similar to what other hospitals have to pay, but the volumes of patients that we treat are much less because our populations are so low in our rural communities. So that's what's making the economics very challenging for us. But I think one of the whoops.
Any questions?
Laura's a little quick on the trigger.
Oh,
It went really fast.
there we go. But I think one of the really unique and interesting things that's going on in the state of Maryland is that we're trying to address this head on. When you look at rural healthcare in the state of Maryland, we've been under this waiver model since the 1970s that regulates pricing, that regulates costs, that regulates the industry. And we're at a point now where that regulation or that system that we've set up back in the 70s is continuously evolving. And I'm proud to share today that that next evolution in our model, in our healthcare model in the state of Maryland, has been signed and approved. And what we're calling it now is the AHEAD model. And AHEAD stands for Achieving Healthcare Efficiency Through Accountable Design. And really, a lot of information on this page, but the takeaway is that the state of Maryland signed a 10-year extension with the Centers for Medicare and Medicaid Services on November 13th of 2025, so just about 2 months ago. The new model covers a 10-year period from January 1st of 2026, just started this year, till 12/31/2035. The goal of the new model is to curb healthcare cost growth, improve population health, and promote healthier living. So that's kind of what I was trying to talk about, is the shift in how we provide care. The aim is to increase investments in primary care, provide financial stability for hospitals, and support connections to communities that provide resources for our communities. So congratulations to the state of Maryland for extending our model into the AHEAD model. I think it does move us in the right direction as an industry and really promotes health and wellness in our community, which is what we really should be all about. But in addition to the AHEAD model that Maryland just signed, the federal government has recognized that rural health care is challenging across the nation. And to that end, they've created a rural health transformation program. What it really boils down to is a $50 billion, it's billion with a B, allocation of federal resources for rural health care services across the country. And they basically divided that $50 billion fund into two portions. The first is baseline funding, so every state in the nation that applied for this funding would be given a portion of that $25 billion. And as you can imagine, every state in the nation applied, so each state will get about $100 million per year over a 5-year period to address the challenges with rural health care in their state. So that is taken place. The deadline for us to sign and submit our application was the end of November, and the CMS approved our application by the end of December. So that first allocation of $25 billion will be allocated to all states in the U.S. Over the course of a 5-year period. The second $25 billion allocation is really designed for grants and for funding that really improves the health and wellness of the community, very similar to what we've experienced with the transition for the AHEAD model. So the state of Maryland just learned that we received $168 million worth of funding from CMS for rural health care services across the state. Again, that 100 for filing the application and an additional 68 million towards rural health care in the nation. The next slide really tries to tell you what that money is to be used for, because the federal government does have very specific intent with this money. The first is to make rural America healthy again by promoting preventative health. What can we be doing to enhance preventative health? Screenings, primary care providers, things that getting patients access to health care much, much sooner before they incur those chronic conditions. So that's one of the first strategic goals. The second strategic goal is to support workforce development by strengthening recruitment and retention of healthcare providers in rural communities. One of the biggest challenges I have as your president for this rural community is workforce.
Yeah.
It's finding providers, it's keeping providers in this region, and ensuring that we have access to care that we need in this community. So again, that's been recognized as a challenge at the national level. But the third element, or the third strategy, is to use technology and innovation to advance the health of our community. I think that's something that we've started to do with COVID. We used telemedicine in many circumstances, from access to primary care and specialists. That is really just the tip of the iceberg of what technology could do to support the health and wellness of our community. So those are really three high-level strategic goals that the federal government has defined, and that should be part of that request for that $50 billion that I just mentioned. So again, this is a high-level drawing of the state of Maryland. You can see in green where these are all counties in the state of Maryland that the University of Maryland Medical System provides care. And just a reminder, the 5 counties of Shore Regional Health are encased in that red box, and that covers our primary service area. So we are considered rural in Maryland, and by the federal designation. We do cover about 2,000 square miles of geography in our 5-county region. That's comparable to the state of Delaware in total, so that's our primary service area. And you can see on this next slide that we only have about 172,000 residents in that 5-county region. I think the important note on this slide as well, though, is the number of Medicare and Medicaid patients that we serve of those 172,000. It's about 54% of our population are either on Medicare or Medicaid. And I share that with you because as we continue to get challenges with reimbursement in the state of Maryland, many of them are government payer reimbursements that we're being challenged with Medicaid and Medicare services. So that is something to keep an eye on as well. And again, in an event to kind of prepare ourselves for this inevitability of challenges with rural healthcare, this slide just tries to share with you what we've been doing over the last 12 to 14 years, really looking at each county, providing local access to healthcare within the communities that we serve, but doing it with the eyes towards a regional healthcare system. That is the University of Maryland Shore Regional Health. So looking at each county, you can see we've streamlined hospitals up in Chestertown. We've created freestanding medical facilities. We've added medical office buildings and access to specialists and primary care providers. And we've closed the hospital in Cambridge and created a freestanding medical facility, all intended with providing high-quality care locally, but doing it in a cost-effective, sustainable regional healthcare system. And that's all been predicated on building the regional medical center as the hub for care in the Midshore region. So a couple of slides on the Regional Medical Center, and again, first I'll say thank you. Thank you to this commission because you have stood up and you've been very early in your efforts to support our hospital system, and we thank you from the bottom of our heart for your continued support in what we're doing. Your financial
Somebody had to get that ball rolling, right?
And you did, and you did. You were first out of the gate for that, and your contributions have gone a long way to us working towards achieving our philanthropic goal for this project. But I'm pleased to say that we've got a couple of pictures here where we started as a greenfield in 2024 in July, and you can see the progress that's being made as the months have progressed to today, where we are drilling geothermal wells on that site. On a 40-acre parcel of land, we're going to drill 1,728 geothermal wells. Each one of those wells will be 400 feet deep, and we're going to use the Earth's core temperature to support our heating and HVAC needs for that new facility. Much more efficient way of doing it moving forward. So we're excited about that. That stage of the progress is progressing. We're also progressing with relocating Route 662 and creating entrance and egress roads off of Route 50 into the project. That's going very well as well. And then just today, we started to lay the foundation for the second floor of the hospital structure. So we're continuing to go vertical with that, with the hospital project. By this time next year, you will see the entire structure of the hospital complete from Route 50. So we really look forward to that progression. So a lot of great things happening from the construction side of things. But the question I get asked all the time is, are you building a hospital that's big enough to support the community needs? There's a lot of development, a lot of growth going on in this community. Is it big enough to support the needs? And I'll just remind this commission that the state of Maryland regulates the size of facilities that we can build.
Right.
That is not if Shore wanted to build a 400-bed hospital, we couldn't. We'd have to go through the state regulatory agencies for that approval. And the state has very specific rules and regulations associated with what
They
we're
had
allowed
to
build.
approve the building of this regional hospital.
That's
Correct?
correct. Yes, that's correct. We had to submit a certificate of need, and that certificate of need gave them the information and asked for the number of beds that we felt were appropriate. A lot of push back and forth on that. Where we landed is with a total of 147 beds in the new facility. And you can see where that compares to 118 that we're licensed for today. So it might not sound like a lot, but those 29 additional beds really gives our team much more flexibility with how we treat patients in our emergency department, how we treat those that are assigned as observation patients, and how we treat those that are admitted in our facility. A lot more flexibility with moving those patients around in a much more timely manner because we've got the right beds now for the right care that we need. Also, each bed is private. They're all private rooms, and that gives us much more flexibility too and privacy for our patients moving forward. So if you ever get asked, did we build it big enough? We build it as big as the state would allow, and we've got provisions in place for future decades in the event that we need to expand the size of the facility.
And these new rooms are all going to have telemetry
Yes.
in them, which I don't think people understand how important that is you're in the hospital, but you're not hooked up to the equipment, and, you know, if you're septic and you go south, like, and there's not somebody checking on you, that could create a problem. This way, you're actually being monitored, and so the nursing knows if your vitals are trending in the wrong direction to be able to immediately take care of you.
Yeah, telemetry specifically references cardiac monitoring.
Yeah.
And we do have a limited number of beds in our facility today that we have telemetry capable monitoring in those rooms. The new hospital, you're exactly right, will be all telemetry capable. So again, that removes a restriction from us moving patients through the system. It makes it more efficient for us, So hopefully, with my short presentation, you can get a sense of what's going on at the federal level, some of the things Maryland is doing, the state of Maryland is doing to advance rural health care in our community and healthcare in general, and some of the specific things that we've focused on in the past, and where we're going with the regional medical center, not only to survive these challenges that rural healthcare is facing across the nation, but to thrive in this environment. So I think we're doing all the right things, and again, I appreciate your support for getting us where we are.
So before we let Laura launch, you had just mentioned some of the increase, the 29 bed increase at the new regional hospital. And then, but previously you talked about staffing. So, I mean, staffing is a concern at your urgent care centers and things like that in the system. So, is it fair to say that with the brand new regional hospital, there's an attraction for doctors and nurses to want to work there, or is staffing with the increased need in staffing because of the larger number of beds, is staffing going to be an issue, or?
So you're exactly right. Staffing is probably one of my main concerns as your president in running the hospitals. Fortunately, we've got a fantastic partnership with Chesapeake College. So Chesapeake College and their nursing program is stellar. I think Cliff Coppersmith shared with me that in the last class, every single student passed their state exams. So it's just a high caliber, high quality program. And those students are trained at Shore, and 90+% of them are
Will
working
feed
at
right
Shore
into
now.
it.
Yes, so it's a significant pipeline for nursing. However, when you look at providers, it's an even greater challenge. And we don't have that pipeline today that supports our workforce, our physician and advanced practice professional workforce. What we've got to do is rely on competition, rely on putting the best offer out there and trying to recruit people to rural mid-shore of Maryland. That's today's recruitment strategy, and it's working okay. We still have a lot of gaps that we need to fill, but it is meeting the demand to some extent. But when I look to the future, our physicians are aging, a number of them are retiring over time, and we really need to have a new strategy. And one of the things that we've done, in addition to building the new hospital, which is a very key strategy in attracting providers to our community, that does work. When they're walking through Easton now, they see our facility and they've got a lot of choices, and they obviously choose elsewhere at times. But with the new facility, that will create a draw for them. But what's also a great strategy of ours is that the School of Medicine, which is in Baltimore, has leaned in to help us with our workforce challenges. And by that I mean they were fixed at a number of 150 students per year that they could accept into their medical school. And they've got thousands of applications, they fill those slots, and it's very, very challenging to have members of our mid-shore community apply and get accepted into those programs. Well, what they've done is they've added 10 more slots to that 150 number. And they've earmarked those 10 slots for rural healthcare and for rural medicine. So they screen now applicants who want to get into rural medicine. They've got 10 slots designated for them. Ideally, they're going to be paying their tuition in full for the 4 years that they go to medical school in Maryland, with the commitment then that they come back when they complete their training and they work in rural Maryland. So that program just elevates our workforce capabilities. 10 students a year over a 4-year period, that's 40 more students that we've got in the pipeline. So we, in essence, are creating that physician pipeline with the School of Medicine's decision to support this. And I really think that as a residency training program on the Shore, we're going to begin to attract those students. Once they get here, our experience is that they like the area, they enjoy the Mid-Shore region, and they want to stay. So that's our long-term strategy for provider workforce.
Is he going to have the students rotate through Easton?
Yes.
Not
East-
just those 10, but
Easton will be a site,
150?
yeah, we do that today to some extent, but this will really open that opportunity up significantly for us. And when I talked about the rural funds from the federal government, that portion of those, we will ask for financial support from those funds to set up that residency program, set up that training program for those medical students, so that we can attract more, and we can ultimately then keep more in this region. So it all dovetails nicely together.
I gotta think that, living in Maryland's rural eastern shore in itself is a recruitment tool. Good schools, it's a great place to raise, kids. We all raised our children here, and so, if they, a future for a young doctor or registered nurse to want to come work at our regional hospital and eventually, raise a family over here on the shore, I think that's got to be one of the recruitment tools.
It is.
To find the staffing.
You're exactly right.
So if you were to guess, how short are we for Easton for clinicians and nurses?
Well, it really honestly depends on the specialty. So if you look at primary care as an example, we're very short. We've got, even though there's a number of private practice groups out in our 5-county communities, even though there's a number of employed providers that we employ as primary care and nurse practitioners, we are short. You look at each county, it's a little different in each county, and it's a little different, but, we're 10, 15 at least providers short in this 5-county region for primary care. But then when you look at some other specialties, we might be a little better off in those specialties than we are in primary care, but it's different by specialty. I'd be reluctant to give you a comprehensive number because it changes, but in addition to the shortage, though, we're also keeping an eye on retirements, and we're keeping an eye on those that are intending to retire soon, so we can add those to the mix and backfill. But let's just say, it's safe to say the supply, the demand exceeds the supply, and we're doing everything we can to make the Mid-Shore region the place to be.
Has the legislature looked into this as well?
Yeah, we have gotten nothing but great support from our local delegations, from our state senators, and from our congressmen and U.S. senators as well. They recognize the challenges. They've supported the AHEAD model as the next iteration of our model, and they recognize that what we are doing on the shore can be replicated, not only across Maryland, rural Maryland, but across the country, and they're standing out and supporting what we're trying to accomplish, 100%.
Very good.
So now Laura's going to bring the plane down a little bit, and I've stayed at the federal and state level. Laura's going to talk about specific things that we're investing in and doing here in Queen Anne's County.
Hi, so yes, I'm Laura Wilson. I'm the Director of External Affairs and Community Liaison. As most of you know, I'm also on the Queen Anne's County Economic Development Commission and have been for a number of years as a Queen Anne's County resident as well. So this slide just shares, this is across the 5 counties, just to give a sense of across the region that Shore Regional Health serves. In the fiscal year 25, we had about 7,524 admissions, just gonna highlight a couple. 71,000 ED visits, emergency department visits, and 45,000 urgent care visits across our 5 counties. Also just wanna highlight the number, we've over the last fiscal year, over 1,300 cancer outreach patients were reached and serving across the counties, and really also just want to highlight our partnerships. I know that we talk a lot about the value of partnerships. Ken just mentioned Chesapeake College, but we can go on and on. I know we have some partners here in the room from the health department, from Mid-Shore Behavioral Health, and those are just key partners for us to continue to reach our patients out in the community. And to the point we were just talking about as well about recruitment. So this shows the number of providers that Shore Regional Health hired in fiscal 25. That's 15 specialists and 6 primary care. So just working on that, filling those gaps, trying to help reach our patients and provide care where it's needed. So Queen Anne's County, as you're aware, obviously has both an urgent care center and a freestanding emergency department. And you can see here that the Ken Island Urgent Care in fiscal '25 served, or had 15,625 visits. And that's one of three. We have 3 urgent cares.
Yeah.
We
Phil was there 1,200 times.
Frequent flyer.
Yeah, that's one of 3 urgent cares that we have across the region. And then also the freestanding emergency department, that's with 17,688 visits. Again, highlighting on this slide the efforts around behavioral health integration, the regional partnerships, the collaboration with law enforcement, and supporting recovery, and just working again with our community partners. So I'm just going to mention 2 other things. Again, I was on a really great call today all about mobile or integrated health. It was put on by the Local Health Improvement Coalition. You all know how robust and exciting the mobile integrated health program is here in Queen Anne's County. Melanie Chappell, who's the PharmD on our team, has worked with this team for a number of years doing those pharmacy consultations and really working with those patients and help keeping them out of the hospital when possible. Also, there's a lot of efforts around population health that we work on with many community partners, going to visit the senior centers, community health education events, doing health screenings, outreach through our community health workers, again, working in a number of different outreach events. And then this last slide just kind of, again, speaks to what Ken was talking about with that workforce, that development, the pipeline for future, not just providers, but staff at all sorts of levels. Community College, Chesapeake Community College has a number of programs that help feed into our workforce, and that's a really great partnership. And we also have involved with the ITCH program. It's the Introduction to Careers in Healthcare, and that's for even younger. That's for middle and high school students, letting them know what opportunities are available in healthcare beyond the nurse and doctors. There's jobs in IT and marketing and human resources, and kind of just opening their eyes to all the different types of opportunities that are available within healthcare. So I think that's my last slide. So I know we already went through a number of questions, but we are open to any other questions?
Or maybe not.
No, you always knock it out of the park, Ken, when you come here.
You know, I've been here for almost 15 years, and I have to say, I love this community, and I love the citizens that we serve. It's an awesome responsibility being the healthcare system for this Midshore community. We take it very seriously as servant leaders. We greatly appreciate your support. We can't do what we do without your support and all the community partnerships that Laura mentioned. It's incredibly important to us, and we just thank you for the opportunity to be your healthcare provider.
So of the $186 million that the state of Maryland received, is that just reimbursement, or is that?
No, it's $168 million, and that'll be for the first year, and there'll be additional allocations year 2, 3, 4, and 5.
So where can that go?
That's typically,
is that operational and capital?
yeah, the slide that I showed that really laid the strategic goals of those funds is where those funds are going to go. So workforce, technology, and health and wellness, improving the health and wellness of our community. So as an example, one of the things we intend to ask for is some funds to extend the MIC program. You know, we've got it running well here in Queen Anne's County. We'd like to have some representation of MIC in all 5 counties of the Midshore. Our SCOT team, our Shore Community Outreach team, social workers going to patients' homes, making sure their medications are taken appropriately, making sure they've got connections to community services. That takes resources. That takes people to do that. These funds from the state could be a grant from that state fund to allow us to hire those team members and provide those services. So chronic, it's about health and wellness, it's about workforce, and it's about technology, really, that they're looking for. They're looking for applications for those funds. At the state level, the Maryland Department of Health will make that determination on where and how those funds are allocated. So it's grant funding. It's not going to be increased in rates. It'll be grant funding from the state.
So would that be a good time to ask for mental health funding?
Yeah, mental health is certainly number one with our community health needs assessment as an opportunity for us to enhance resources and extend the services that we provide. So yes, and one of the things we're working on now is doing an assessment of our outpatient capabilities for behavioral health services. And we could always stand to improve how we do that. So again, working with Katie and the Midshore Behavioral Health Coalition, we've got a good story to tell, but we've got a good opportunity to identify. And I envision a time where we'll do a joint application to the state of Maryland for Midshore Behavioral Health Services that Shore promotes, as well as Katie and others, to just demonstrate community partnerships, demonstrate regional needs, but demonstrate that it's a serious
Need.
and an opportunity for us to improve. So absolutely.
Can you elaborate more on that? You know, can you kind of fill the gents in about our conversation at Easton and
Sure.
where we're going with that? And
Sure. So, you know, when you look at behavioral health services, there's really two major categories of what's provided: the adult services that are offered and child and adolescent services that are offered. And within each one of those categories, there's the inpatient demand or need, and there's the outpatient services that support those needs. So really, inpatient and outpatient for adults, inpatient and outpatient for child and adolescents. And when we look at what services we are able to offer, what we always try to do is look at the full continuum of care, identify where those gaps are, and how Shore and other partners can fill those gaps as best we can. But not just for today and tomorrow. It's got to be a sustainable program that extends the length of time that's needed. So it's got to be financially viable. It's got to be something that the community needs and will utilize. So when we look at behavioral health, you know, we bring our expertise to bear. Our partners with Katie and the others come to the table, and they share with us what's currently exists outside of Shore and where some of those gaps could be. Well, we originally thought that there may be a gap in inpatient beds for child and adolescent patients. And now we're finding that maybe that's not as big of a challenge as we once thought. So we're going to validate that. That's the first step, is to validate that the supply is meeting the demand. The supply of beds is meeting the demand in our Midshore region, with the intent of keeping Midshore residents on the Midshore or on the Eastern Shore, and not needing to go to Western Maryland or even to the Western Shore for their care. So are there resources on the Eastern Shore that we could utilize? We're validating that exists, that there are enough resources to support that demand. But what we're also validating is there's probably not enough outpatient resources for child and adolescents to support the demand that's there. And that may be where more of our focus needs to be applied. And that would be on an IOP program, an intensive outpatient program, a bridge clinic, a bridging you between provider visits. So we're identifying the continuum, trying to hone in on exactly what's needed, and then working with our community partners to validate that, but then also looking at resources that, like the state funds, now that we've got through the Rural Health Transformation Fund, to help support the cost associated with bringing those programs to fruition. So it's a great time in that we've got partnerships. We may have some resources to support what we need, and now it's just a matter of fine-tuning exactly what they are, where we should put them, and how we should go about doing that together.
And I think the key to the success, certainly, and just discussing it, you know, amongst ourselves of late, is the sustainability. You know, obviously, costs are always an issue, whether it's providing healthcare or providing a product that is needed. You know, bringing the product to market, you know, research and development, bringing the proper staff and people there, that all costs money. And so you've got to have consumers or users in order to justify the expenses. So it's a challenge, and good luck.
That's a great point, especially when you develop these programs with funds that will sunset in 5 years. So it really is incumbent upon us to make sure that what we do can sustain that fifth year and continue, or else that's when you run into trouble. That's when you start running negative margins as hospitals, and that's when you're starting to cut back services, and that's what we don't want to get into.
Let's face it, running a hospital is a business. It has to be treated as so.
The financial economics have to work for us to sustain operations. And we've done all of the work that's needed to right-size our facilities at each one of our communities, provide the right regional access where appropriate, and provide the right facilities to support that regional access. And now we're asked to invest more and more in the health and wellness of our community, so we've got to do that as well. And we just have to make sure that we can sustain those operations moving forward.
Mr. President, on the Western Shore, if there's a child or an adult that needs mental health, inpatient or a PHP or an IOP outpatient, does the University of Maryland have a facility that they send them to?
University of Maryland does have inpatient bed capacity as part of the medical center downtown in Baltimore.
How about outpatient PHP, partial hospitalization program?
I'm not sure of that off the top of my head. I don't know if. Katie
So
would
if,
know.
any idea how many beds there are?
I don't off the top of my head.
So if those beds are full, where do they go? They go outside of the IDN network,
Shepherd
right?
Pratt is
Right.
a significant resource for the state of Maryland, so they have a number of beds where those patients would go to.
So I guess my concern is the census that was looked at was 5 counties. And I can understand that. It makes sense that that census may not be as high as the Lower Shore or certainly Anne Arundel or Howard County or et cetera, et cetera. If those beds in your facility in Baltimore are full and you've got to send them to Shepherd Pratt, there's a cost for doing that, right? A lost cost. If we had a facility on the Eastern Shore, like at Chestertown, you would have those patients stay within your system, and the Medicaid dollars would flow into your system. Therefore, wouldn't have to go outside your network. So I guess my point is, I appreciate all the work that you guys have done, and I really do. I'm asking to look beyond the census of just the 5 counties, because we know that at both Shepherd Pratt and Brook Lane, there could be days and days and days and weeks waiting to get a bed. And there are. And that's just the numbers that they are. So if you're just looking at the 5 counties, I can understand that the census might seem low. But if there's an available bed and a facility that we would like you to do on the Eastern Shore, they're going to come from the Western Shore because there's not enough beds on the Western Shore. And we certainly don't want to send them out of state, because now the Medicare dollars have doubled because they want a higher reimbursement from the state of Maryland. So by getting more beds here on the Eastern Shore, of which we have very few, have you looked at those at that census for the whole state, not just for the 5 counties?
I think part of our assessment is supply and demand. It's what is the comprehensive demand and what are the supply of beds? Again, with the intent of keeping our patients on the shore where possible. So we're still in that investigative process. We are working with our other partners on the Eastern Shore to make that assessment. And again, maybe a year ago, we really couldn't have or didn't have that conversation with our other partners outside of the Midshore on the Eastern Shore, but now we're doing that. So I think it's an assessment of what exists and does that meet the demand? And if it does, then let's look at other parts of that continuum so that we can address the whole patient and not just the inpatient demand side of things.
You had mentioned that it was $6 to $7 million to upgrade the 3rd floor of the Chestertown Hospital, and 1.5 to $2 million in lost reimbursement shortage. If we were able to go to the state, to the House or the Senate, and request that funding, would that solve the problem of the funding issue?
It may solve the problem of the funding issue, but it may not be needed. Those funds may be better served in other parts of the continuum because the bed capacity that we need may already exist in the Eastern Shore. So if the bed capacity exists on the Eastern Shore, why would we reinvest in more beds and not in other parts of the continuum where the care is really needed as well?
Well, that funding would also be for the PHP IOP as well.
Well, again, I think we are really looking at this. We're bringing our experts to bear on what's the appropriate solution here. And as you can hear, it's a very complicated, complex problem. But just rest assured, as one of our major areas of focus through the Community Health Needs Assessment, behavioral health services is near and dear to our heart. We need to look at what we're doing today and improve and look at the entire continuum. And again, bringing the experts like Katie and others to bear is really going to help us make the right
Do
recommendation.
we know roughly what the cost would be to upgrade the Cambridge facility? The second floor
For the outpatient side?
for the
Yeah, it's-
partial hospitalization?
That one's minimal because that service already exists for the adults in our community. So to allow us to transition it for child and adolescents, it's the renovations or the extensions are minimal. It's more about the staffing associated with that service line.
Would that still be like $1.5 to $2 million shortage after reimbursement?
As far as total bottom line, no, I think for, I don't know if we've done the assessment on the margin associated with those services, but it's not near that amount of money for the outpatient services like it is for inpatient.
All right,
Very
Thank you for
good.
your time.
yeah,
Welcome, thank you.
thank you.
And Laura, thank you.
Appreciate it,
Thank you,
Thank you
guys.
both.
Thank you.
Take care.
Yeah, looking forward to the next one.
Yes, indeed.
Thank you.
Take care.
Thank you very much. Have a good evening.
You too, thank you.
Commissioners, concludes our presentations for this evening, unless Linda Ray showed up? No. Okay. We'll invite her back for another meeting. Okay, so if you want to turn to tab number 2, we have one action item for the Sanitary Commission. This is Department of Public Works Sanitary Commission. So tab 2, item 1, pages 1 through 8, we have an easement for Comcast on our vacuum sewer station collection M property at 600 Graysonville Cemetery Road. And this is for service down Fawn Lane, which is right on that hairpin turn. 5-foot easement for installation of Comcast.
We have
service.
to convene as the sanitary board.
Yes.
To do that.
Yes,
So I
please
make
do.
a motion, we convene.
Second.
All in favor?
Aye.
Yep, so this easement has been approved by the sanitary district staff, Alan Quimby, and just seeking approval from the Board of Commissioners. Sanitary
I
Commission.
move that we execute the easement agreement with Comcast Cable Communication Management LLC for a 5-foot wide easement across the front of the lands of Collection Station M in order to install fiber optic cable.
Second.
We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
All right, thank you, Commissioners. Now, moving to tab number 3, we have 7 additional action items. So tab 3, item 1, page 1, we have Proclamation 2602 for National Mentoring Month. So I think we have some representatives here from Big Brothers and Big Sisters. You want to come on up?
Come on up.
Please. And
Go ahead and read it.
Commissioners can read, yeah.
All right.
Have a
Good
seat,
evening.
make yourself
Have a seat.
comfortable.
All right. This must be a big sister, I guess, right?
Proclamation 26-02. Whereas at the start of each new year, we observe National Mentoring Month to honor the mentors who devote their time, their guidance, and their hearts to lifting up our young people. Leading by the power of their example, mentors represent the very best of our community spirit and shared commitment to caring for one another. And whereas success of our local youth is a joint community effort, each child's confidence and resilience is strengthened by someone who shows up, consistently listening, encouraging, and helping them see what is possible, whether it is helping with homework, building life skills, trying something new, or navigating a tough moment. Mentors make a lasting impression. Through that steady support, young people are empowered to dream bigger, work harder, and believe in their own potential. And whereas Big Brothers, Big Sisters of the Eastern Shore's life-changing work supports youth and families facing adversity through Queen Anne's County. Through the agency's mentoring program, enrichment activities, and vital resources for local youth and families, they help ignite the power and promise of youth across the county. Mentoring is more than a program. It is a relationship that helps young people feel seen, supported, and capable of reaching their fullest potential. And whereas during National Mentoring Month, we celebrate the mentors, families, volunteers, partners, and supporters who make mentoring possible. Partnership with Big Brothers and Big Sisters of the Eastern Shore shows our commitment to serving Queen Anne's County community by supporting an organization that empowers youth, strengthens families, and builds a brighter future for local children this month and throughout the year. Now therefore, we, the County Commissioners of Queen Anne's County, do hereby proclaim January 2026 as National Mentoring Month in recognition of the transformative impact of mentoring, and in celebration of Big Brothers, Big Sisters of the Eastern Shore, and all who support its mission. We call upon community leaders, educators, businesses, civic organizations, and residents across the county to observe this month and to consider becoming a mentor, partner, or supporter to help ensure every young person has the opportunity to meet their full potential. Signed by all of.
Chris, can I have that real quick for a second? Anything that you want to share, or?
So I am Kelsey Haft. I actually just took over the Queen Anne's County office on Kent Island, Kent Narrows. So we're going to be doing a lot more in this area shortly. I just want to thank you for recognizing National Mentoring Month and Big Brothers Big Sisters of the Eastern Shore. In 2025, just in Queen Anne's County, we've supported 1,100 youth, provided over 8,000 resources, and we have almost 5,000 volunteer hours for the year. We had an impact report, and 99% of youth report improvements in self-confidence, critical decision-making, and their overall sense of the future after being enrolled with us. So very important, and we would really ask that you consider becoming a mentor or volunteering to support an activity or participating in a local fundraiser, in which we have a lot of events throughout the year.
So are you guys doing any kind of partnering with local organizations like Giving the Edge or Living the Edge, Bobby Woolley and his team?
I know that we work closely with a few places, Haven Ministries. We have a lot of business partners, so local people like The Edge,
Right.
stores. We have a pretty large contact list, but I don't know the specifics because this is my second week, so.
Well, I would certainly reach out to Bobby and see what he can do to help. I know that you guys this is newly opened in Queen Anne's County. Your presence before that, you guys were coming from what, Kent County or Cecil? Where?
There is an office in Kent County. It's
Yeah.
not largely staffed. I think the biggest is in Salisbury. I think most people come from Salisbury, so it is really just kind of getting started seriously over here on this side.
Well, good for you, and we appreciate your presence. Yeah, I would certainly, your business plan is to reach out to local business owners to find those mentors and the folks that want to work with the kids that need, that guidance, that mentorship. And I know that Bobby Woolley and his team over at The Edge, he's got a foundation called Giving the Edge. So I would certainly look into them as perhaps a future partner.
Thank you.
Do you want to explain a little bit to the audience about what they do as a mentor? How often do they
Sure.
see the student?
So generally, you would want to be a mentor to a youth in your county, but sometimes if it's not too far, you could maybe go from Kent to Queen Anne's. Maybe if you work in Queen Anne's and live in Kent. We ask that you give 4 hours a month, and that could be an hour a week after school. It could be 2 hours on Saturday every other Saturday. It's really up to you, and obviously what the needs of the child are. We do have a very extensive screening process, so that is a bit of a deterrent for some volunteers and mentors, but it is all in the, in the safety of the child. So that's something that kind of deters people a little bit, but generally it's just 4 hours. We ask that you commit for a year. Longer than a year, it does become a very serious relationship. We have some matches that it's 15 years and they're still they stood each other's weddings, really long relationships. So we ask for the dedication, and we ask that you're actually an adult, respectable role model, because that is the point.
Well, that counts you out, Jim.
Gotta search somewhere else now.
Right, but so if anybody what would they do? How would they reach out to you if they wanted to become part of this program, or at least get some more information about becoming a mentor? How would they get a hold of you?
There is the national site, Big Brothers Big Sisters of America, very large volunteer tab. We also have Big Brothers Big Sisters of the Eastern Shore specifically, that also has a volunteer large button. You just put in your basic information and then one of us will reach out to you. You can also reach out to one of us individually. We go to a lot of different things, so you might get a business card. But most of the ways that we get interested people is through the website, or if they sign up on one of our outreach tables at, Centerville Middle School has their spring thing and the fall thing and things like that.
Have you talked to Melinda Ray?
She's still cutting her teeth here.
Oh, right now.
Well, if you think there's anything that we can do as commissioners to help you out, get settled in, please feel free to reach out to our office.
Thank you.
Thank you.
Talk to Melinda Ray, she's with Character Counts.
Okay,
I don't know her contact information, but
I'll write it down. and
We'll get it to you.
Look it up.
Thank you.
Thank you very much.
Thank you. All right, Commissioners, moving on, we have, next we have 2 CREP easements. So item 2 on pages 2 through 14. The first one is Conservation Reserve Enhancement Program Agreement of Sale and Project Agreement for Michael Raymond Bostick Jr. This is for 58.63 acres of a 264-acre property owned by Mr. Bostick, ready to be submitted to Maryland Department of Natural Resources. It includes an agreement of sale and a project agreement to be signed by the county commissioners. This is funded through Program Open Space. No county funds are being utilized for this easement.
I move to execute the CREP easement agreement of sale and project agreement for the property owned by Michael Raymond Bostick Jr.
Second.
We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
And I'll mention too, Mr. Joe Pippin is here if you have any questions about either of these. So our next one here, item number 3, on pages 15 through 25, is Conservation Reserve Enhancement Program Agreement of Project Sale, an agreement for Joe Lippy Farms of Queen Anne's County, Maryland. We have 42 acres of a 75-acre property owned by Mr. Lippy, ready to be submitted to DNR, and it also includes the agreement of sale and project agreement to be signed by the commissioners. So no county funds, again, utilized, all coming from Program Open Space.
I move to execute the CREP easement agreement for sale and project agreement for the property owned by Joe Lippy Farms of Queen Anne's County, LLC.
Second.
We have a motion and a second on this item. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
All right, thank you, Commissioners. Joe, well done, thank you. All right. Item 4 on pages 26 through 29 is from the National Association of Counties. This is our annual membership dues payment for $997.
I move to approve the National Association of Counties 2026 membership dues in the amount of $997.
We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
Thank you, Commissioners. I just mentioned that NACO is celebrating its 90th year in business now, and they also have a very extensive list of accomplishments over this past year in the book. Item 5, moving on, is USDA final closing forms for the Sudlersville loan assumption on pages 30 through 79. The closing for the loan assumptions for Sudlersville is on January 22nd of this year. There are several documents requiring signature by the Commission President, Mr. Moran, for his signature for the water loan, the sewer loans, and the Barclay extension, all in $5.2 million.
I move to execute the final closing documents for the assumption of the Sudlersville USDA loan.
Second.
We have a motion and a second. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? So moved.
All right, thank you, Commissioners. Item 6 is from the Clean Chesapeake Coalition. This is the invoice that we tabled at the last meeting. This is for the water quality certification for the Conowingo Dam. Since that time, the appeal has been withdrawn by all counties. So I need a motion if you want to pay the invoice. I mean, the appeal was filed. I do know that Kent and Dorchester County did pay their invoices.
$5,000 to the Clean Chesapeake Coalition for the contribution for administrative appeal to Maryland MDE for the revised water quality certification, Conowingo Dam relicensing.
Second.
We have a motion and a second. Any discussion? So we are paying this for something they're not going to do?
Well, the appeal was filed to preserve our right in the appeal process, and then it was withdrawn later. As you know, we had that discussion at MACO with our fellow counties, Dorchester, Cecil, and Kent counties. I know Kent and Dorchester did pay the invoice. The work was done, I'll say that, and then
So that was.
it was
okay,
withdrawn.
so-
It was
Was
withdrawn.
done.
Okay.
It was,
okay,
yeah.
I got you. Okay. Any other discussion? All those in favor signify by saying aye. Aye. Opposed? Abstained? So moved.
All right, thank you, Commissioners. Item number 7 on pages 81 through 85. This is from our Parks and Recreation Department. This is for the acquisition of a new ABI Force Z23, otherwise known as an infield groomer, from Lawn and Golf Supply in Phoenixville, Pennsylvania, for $29,999. This is under a pre-established government contract.
I move to authorize the Department of Parks and Recreation to purchase one 2025 ABI Force Z23 infield groomer from Lawn and Golf Supply in Phoenixville, Pennsylvania for $29,999.
Second.
We have a motion and a second. Any discussion?
You know, I didn't think we could improve on perfection at our ball fields, but kudos to Parks and Recreation for an attempt to continue to be the best ball fields in the entire state of Maryland.
I saw this on eBay for $300. That was the opening bid, though.
And also in my motion, I'd like to say that we let Steve go first once in a while, because he's always here as the last one.
I was just thinking that.
Always the
Because
last.
he's always here, he's always asking for
Stephanie,
something.
let's move him up.
Gotta put the effort in.
Let's move poor Steve up on the agenda.
There you go. There you go.
Steve, I was
you
thinking
have a
about
motion
it, then
and
it
a
just
second.
slipped my mind.
All right, we got a motion and a second. All those in favor signify by saying aye.
Aye.
Opposed? So moved.
Let's wait till Jack gets back to vote on this.
Hey, so real quick, so you know that it's not mandatory this year, will it be next year, though, is that second first base. So the high school has to agree that they want to participate, but they definitely have to next year.
bases on
So
the
just
first base?
food for thought. I don't know if that's the schools that have to buy those bags. I guess it's the AD's responsibility. There you go. So I think I would reach out to the high schools, and the 2 high schools, and find out if they're going to participate in that safety base at first. So you know ahead of time you're going to have to put those posts in. Thank you, sir.
So 2 bases on first base?
Yeah, it's for safety reasons.
Press and public comment. You got anything? We got nothing there.
played
We got
in our bare
Beth,
feet
you want to
when we
speak?
were kids.
Nope. Okay, we'll close press and public comment. Round table. Patrick, you're up.
Quick, he's got nothing.
Okay, that's fine. It's all good. Phil, you're up next.
Again, Happy New Year's to everybody who's watching this evening. I'm looking forward to an awesome 2026.
Having Ken here reminded me, back when they were going back to doing the fundraising efforts, and you and me and Ken had a lunch at the Narrows with Gary Mangum, who was doing a lot to try to raise money.
He came here in front of us.
For the hospital.
Yep.
And Gary Mangum passed away in December, and he was a tremendous asset to the community, very giving person. So just wanted to mention that and how impactful he was. If we could have everybody do a fifth of what he did, imagine the amazing things the community would have, so.
Thank you.
That's it.
With that, I'll take a motion to,
Make a motion to adjourn.
thank you. All in favor?
Aye.